Can you describe the experience with cosmetic medicine and the importance of injection technique, and how does this benefit girth enhancement? In cosmetic medicine, the importance of injection technique is extremely important, and the reason it is because the injector or provider has to have absolute mastery control over the syringe, because we're dealing with very exact amounts of product. And the reason this is important for girth enhancement is because you want to make sure that the product is delivered evenly and smoothly in a uniform distribution. Can you provide a general summary of what your girth enhancement procedure is about? So at Ageless MD, we offer a variety of different fillers as well as fat transfer to enhance the overall girth of your flaccid and erect penis. And we also use dermal fillers to enhance and increase the size of the glands. What filler options do you provide for this procedure? What are the pros and cons of each filler? And which do you recommend the most for girth enhancement? At Ageless MD, we use a variety of different filler products to enhance the girth of your penis. The most obvious, of course, would be a fat. So that would involve a fat transfer, which involves a miniature liposuction, where we take the fat from your lower belly or your flank and process the fat, including micronizing the fat down to nanoparticle size, and then injecting that all along the circumference of the shaft to increase your girth. Of course, the fat is the best fill in the world if you have fat. If you don't, there are a lot of other choices, such as fillers made of hyaluronic acid, and that one is called Juvenin Voluma. There's also another filler called Radius that we use, and that is made of calcium hydroxyapatite. The reason I like this filler in particular is that calcium hydroxyapatite is the same ingredient as found in your bones. And so what better product than something that's made in your bones that we can put into the penis to mimic a firm, hard erection. Lastly, we do have a product called Renuva. It is a dermal matrix. Basically, it's derived from a donor's fat, and it comes in a powder form, and we mix it and we inject it along the circumference of the shaft, and it causes your body to produce or grow its own fat. So for those that do not have fat to transfer, this is another viable option that we can get increases in girth without undergoing a miniature liposuction procedure. Does this procedure involve general or local anesthesia? What are some common complications with this procedure? This procedure is all done under local anesthesia. I find that this is generally sufficient enough, and we also combine and offer nitrous oxide or laughing gas. If you are at all nervous prior to coming in and the day of, we can also prescribe some sedatives such as Ativan or Xanax with some painkillers that will give you a very similar calming and pain-free effect as general anesthesia. Some of the common complications of this procedure are, of course, bruising and swelling, and usually that is self-limited and lasts between 7 to 10 days. We usually recommend to not use the organ for at least 1 week after the procedure, just for obvious reasons. You're bruised and swollen, it's gonna be sore. And plus there's open wounds there, so you wanna make sure that those open wounds are completely healed before you actually try to use that, your new toy. What kind of girth can a patient expect to gain? What's the most someone can gain in one procedure? Can a patient have multiple procedures for additional girth? So generally speaking, for our fat transfer patients, we can put upwards of 50 cc's of fat at a time, and patients can expect in one procedure to have 15 to 20, 25 maybe % increase in girth enhancement. So for example, if you're starting off at a flaccid circumference of 4 inches, you could reasonably expect to go to 5 inches in a circumferential measurement. And that's visually quite significant. For dermal fillers, we don't want to put too much in at one time. I generally like to cap that out between 10 to 15 cc's of dermal filler per visit. And you're gonna get a mild increase in girth enhancement with that, nothing really significant. And then when you build upon that over multiple sessions, you can grow and increase the amount of syringes. You can go up to maybe 40, and usually a sweet spot is usually about 50 mLs for a really average sized penis to see a really significant girth enhancement. How does a newly enlarged penis feel and look like? Does it appear natural post-op? We usually follow up with the procedure about 2 to 3 weeks afterwards, and at that time, the swelling is gone, the bruising is gone, and you can really appreciate the final result from either the fat transfer or the dermal filler placement, and really enjoy what the result's gonna look like for the next year or so. Can this procedure affect the functionality of the penis? For example, urination, ejaculation, erection, and sensation. So the procedure itself should not affect the function of the penis, such as urination, ejaculation, erection, and sensation. In fact, many of our patients combine the penile enhancement with PRP, which stands for platelet-rich plasma, and when that happens, the PRP has regenerative properties, so it actually increases the quality of the erection, increases the duration of the erection, and increases the actual sensation around the gland, so overall giving a better, more pleasurable experience. Is there any length achieved through this procedure? So the procedure doesn't necessarily give you increase in length per se, but more than half my clients who experience and appreciate the increase in girth also states that their flaccid length increases as well. So that is definitely a beneficial side effect from the girth enhancement. Where are you located? Where can a patient learn more about this procedure? Our office is in Tustin, which is in Orange County in the heart of beautiful Southern California. You're the newest Fallow Board sponsor. Explain what it means to be part of the newest wave of physicians innovating the field of phalloplasty and girth enhancement. So I'm extremely honored to be one of the newest sponsors for the Fallow Boards community, and I'm very excited to be part of the newest wave of doctors that is innovating the field of phalloplasty and girth enhancement. Some of my long-term goals is to elevate the entire space of phalloplasty and penile enhancement and make sure we educate all the clients on all the different possibilities that can be had and do it in a very safe manner. What's interesting is to find out what different products may be coming here to the United States that will eventually become FDA approved. Right now we have certain limited options because of FDA, and I was even one of the first doctors to actually use the product called Renuva, which causes your body to grow its own fat as an alternative to fat transfer because it's straight out of the box to increase girth enhancement. But in other countries, they have other products already that we don't have here. So I'm really looking forward to seeing what is going to be FDA approved and be allowed to be utilized in the United States in the near future.